are very glad to associate with Stryker because they've got more than 1,500 robots across the world. These 1,500 plus robots have done more than 1 million replacements, hip, knee, unicompartmental knee, etc. We chose Stryker because it has three main features which contribute to safety as well as precision. Your question was specifically about safety and precision from patient point of view.
Yeah.
So the first important thing is that in terms of precision, the Stryker robot depends on a CT image done of the joint so that we are able to study the joint prior to going into surgery, right? Normally conventional knee surgery depends largely on going kind of blind. You see the x-ray, you know there's a problem. When you open it up, that's when you get to know. So robot definitely offers more precision in that sense. The second important thing is that in terms of safety, you see there is a control and it cuts to a particular point. Now because there is precision from the CT scan, the robot is able to use something called a haptic technology. So that has got larger control over the surgeon who's operating. He has better control over the field of the surgery. As you know, this is a complex surgery. There are two components which have to be removed, parts have to be replaced, and then it has to be closed again. So from that angle, it is ultra safe. And I think the most important thing is, from a routine patient's point of view, patients want to go home faster. Patients want to have lesser blood loss, lesser stay in hospital. And all of us understand that lesser stay in hospital, patient goes home faster, mobilize faster, there is faster recovery. आपका और मेरा काम ये है कि हम पेशेंट को सोसाइटी में जल्दी वापस भेजें, पेशेंट जल्दी अपनी नौकरी में जाए या अपने फैमिली के बारे में देख रेख कर सकें. So from that point of view, we believe that this will be a change which is huge. It will contribute to a faster turnaround time of the patients going home from the hospital, and that's why overall there will be a benefit in terms of one, safety, two, precision, and third, patient going home faster in terms of the overall hospitalization.
With this machine, how many operations a doctor can do assisted in a day as compared to previously?
So there will be a learning curve in terms of time because you know when Dr. Kollapi does it today, he's already completed 2 surgeries within 4 hours. Our normal surgery normally takes about 3 hours for one surgery. I think when all the surgeons have finished their learning curve, which takes approximately 10 to 15 surgeries to get the learning curve completed, they should be able to do a surgery in approximately 2 hours as compared to 3 hours. You see, this will minimize the risk of extra anesthesia. It will be able to make the OTs more efficient, and therefore our patients will be out much faster.
What is the cost of hip transplant surgery?
Cost of hip transplant surgery remains right now the same. There will be some additional consumables which are used for the robotic surgery. We would be taking the charge for those consumables.
Thank you.
So since last how many years you are doing this practice, and now what exact result you are expecting, sir? Because many people suffers nowadays a lot, and the cost is also too high. So what is your opinion on that, sir?
I would say today that Bombay is very busy in terms of the number of hospitals. So I think in terms of cost, probably Bombay is quite cheap as compared to some of the other metropolitan cities. We've been working, this is our 33rd year of existence of Wokat Hospital. 33 साल से हम Wokat Hospital चला रहे हैं. And हमें लगता है कि पेशेंट्स के लिए जितनी ज़्यादा सहूलियत हो सके, अगर वो एक दिन कम हॉस्पिटल में रह सकें या फिर उनको कम पेन हो या कम ब्लड लॉस हो, तो यही सब तरीके हैं जिससे हम पेशेंट्स को सर्व कर सकते हैं.
But it is really worth to do it. There are still people are having the doubt. They are saying that whatever has come due research, but still people are not fully satisfied.
देखिए सर, कोविड के समय में भी जब अलग अलग ट्रीटमेंट्स चल रही थी, तब वोकाट हॉस्पिटल वाज द फर्स्ट हॉस्पिटल टू यूज autologous immunological parameters to save patients. So I think there will always be people who will have some doubts, but I think Wokat Hospitals is committed to improve the care of patients, and this robot offers the perfect opportunity for us to enhance the quality of care and safety level that we are able to offer to our patients.
Thank you, sir.
सर ये जो आज अनावरण हुआ हम देखे ओकार हॉस्पिटल में, क्या ये जितनी भी ओकार के ब्रांचेस हर जगह हर हॉस्पिटल में रहेंगे कि साउथ
अभी तो इस हॉस्पिटल में जो दक्षिण मुंबई में है, यहाँ पे हमने लिया है. जैसे जैसे हमें लगेगा कि इससे काफ़ी पेशेंट्स को सहूलियत हो रही है, हम कोशिश करेंगे कि सारे हमारे अस्पतालों में.
ओके, थैंक यू सर.
My name is Aman Rishi. I'm the managing director of Stryker in India, and we are very excited about this this partnership with Wokhart Hospital. What we believe in making healthcare better, and we partner with our customers in providing solutions that improve patient lives. And we are hoping we are able to actually achieve that same objective here with Wokhart Hospital. And it is a great partnership. It's a testimony to the fact that the Wokhart Hospital believes in making better outcomes for patients. We believe in the same. So it's a great partnership for us.
So do you think that nowadays a lot of research is going on and day by day new research are coming on? So what is you want to say on that, sir? We want the safe and the price competitive, sir. Because the price is too high, whereas we in India, we are more or less poor people or middle class. Very high quality people are very less, sir. So we want something where middle class people can also be benefited, sir.
So you have two questions, I'll answer both of them.
Yes.
One is the innovation. So Mako is the only robot in the world that has three applications: partial knee, total knee replacement and total hip replacement. No other robot has all the three applications. So we stay ahead in terms of our innovation, ahead of our competitors' market. So we have the best technology available, most advanced technology available. As far as the cost question is concerned, cost is one lens to look at anything. What we are able to achieve with Mako is personalized care, reduced bone loss, reduced risk of soft tissue damage, and precise alignment, which has tremendous amount of benefits for the patients over a long period of time. Pain, lesser pain, faster recovery time, and better mobility and all. So if you look at that benefit, then the benefit outweighs the cost in that sense.
So how long this surgery will take, sir? And in how many days or how many months person will be really cured or feel much better than what he was?
So I'm not qualified to answer that fully, but I would say typically the timing depends on the surgeon's progression. So initially they'll take a little bit longer, and then gradually will become efficient. But in terms of recovery period, depends on each patient, very different to each patient and each one.
So one small question I'm little bit hesitant to ask. So nowadays robots are doing everything. So what will do human beings, sir, then? When everything will done by robot, then we human will be replaced, sir. So what do you want to say on that, sir?
So
And why the doctors are bringing robots, sir? Wherever this human got brain, we are the one we developed the robots, sir. And now this robot will come, so we human being will be, all doctors will be paralyzed. What is to be done in that?
So if you look at Mako robot, it doesn't eliminate the surgeon from the picture, right? Our design philosophy is to keep the surgeon at the center of everything. So what this is able to achieve is actually elevate the outcomes along with the surgeon without replacing the surgeon. So it is actually not replacing the surgeon, but the surgeon is still the one who's actually doing the surgery. What it does is it allows the surgeon to do a pre-planning ahead of time. So there is a CT scan that goes on the Mako robot that allows for a better planning, and then based on that, proper cutting, precision of alignment planning is sort of there, which allows the surgeon to achieve better outcomes. These are problems that were untapped in the past, and surgeons are very happy about getting this kind of solution. So it's not eliminating, to your question, it's not eliminating the surgeon from the picture, which is what we strongly believe in. We actually designed this whole robot with surgeon in the center of everything.